Return to running and sports postpartum, what your doctor doesn't tell you, or what they don't know sometimes. A little bit about me. I've been a licensed physical therapist for over 20 years. I own Iron Horse Physical Therapy and Pilates Incorporated. I am a fellow of the American Academy of Orthopedic and Manual Physical Therapists, a strength and conditioning specialist. I'm also certified to teach Pilates, TRX kettlebells, and postpartum corrective exercise specialist. And I created the Bulletproof Runner and core and pelvic floor reboot camp. I created these programs out of a need that I saw in the community. And, maybe more importantly, I'm a mother and an athlete myself. I've been a runner for over 25 years, and I've completed like 6 half Ironmans and countless half marathons, a marathon, tons of trail racing. And a lot of it I did, postpartum after my daughter was born. She's 7 now, and I got into this pelvic floor specialty in sports and ortho after experiencing and seeing, the lack of direction and guidance that postpartum women have after they have such an activity that's has such an enormous impact on their life, getting pregnant and birthing a child. So I was really disappointed in the lack of guidance and the lack of standardization for postnatal care. And so that's why I got into all of this. Let's go to the next slide. With objectives, we're gonna, discuss when it's appropriate for women to resume sports and impact in the postpartum period. We'll review suggested criteria for return to sport and running. We'll discuss risks for returning to sport or running too soon, signs of core and pelvic floor dysfunction. We'll talk about physiologic demands of running and review current guidelines for safe return to runner sport. And I say running or sport, but I am going to be primarily focusing on running just because a lot of sports also incorporate running, or a lot of sports require running and some form of impact. And when I say sport, it could be CrossFit, it could be P90X. A lot of women will do these mommy boot camps or beach body workouts that require quite a bit of jumping and impact. And we want to be able to give those women some guidance. So rehab after pregnancy, this is so ironic to me because, in the sports and orthopedic world, if you have like hip or knee surgery, you automatically pretty much get a referral to PT. I mean, that's the standard of care. You start doing isometric exercises almost immediately, and there's early mobilization emphasis. And, someone mobilizes your scar usually around 4 to 6 weeks. And there's definitely protocols for return to sport. There's ACL protocols, there's, total hip replacement protocols. And there's definitely guidelines with these weekly milestones you're supposed to meet, along the way. And for some reason, you have this enormous life-changing event, which is, birthing, or actually first growing the baby and carrying the baby, and then actually giving birth to it, whether it's vaginally or via C-section. And for some reason, we don't have any good protocols. We don't have any really good guidelines until recently. But, certainly when I was pregnant, I was really disappointed with the lack of information from everywhere. I had to piece together a lot of, what I followed just from my background in sports and orthopedics and in strength and conditioning. And then I got into pelvic floor rehab. So I was able to piece together a lot of these things, but, most women aren't going to have the energy or the background to understand and be able to interpret all that stuff. So, that's where a lot of my work comes from, just from the need I saw with some of my mom friends. Um, and so currently the the rehab after pregnancy, if you want to call it, the current recommendations, it's like, okay, well, before 6 weeks, before your 6 week checkup, don't do anything, just walk, right? And then you go and you do your 6 week checkup, and then magically you can do everything. It's like, okay, now you can do all of the things, which I think is pretty funny because it's not like that 6 week mark is just like the turning point. You have to remember, for 6 weeks the mom has basically become very deconditioned. They're also sleep deprived, they may be overwhelmed, who knows what kind of support they're having. There's a lot of other factors going on in that 6 week period. And if we just tell women to do nothing and just walk and then immediately clear them for everything, it just doesn't make a whole lot of sense to me. So that's what this slide is about. And, I say this, and then I'm going to tell you what actually happened with myself, or what I did. I did a sprint triathlon at 11 weeks postpartum. And, I did a sprint because I was nursing and I wanted to make sure that I wasn't going to have engorged breasts during my run or during my triathlon. I didn't want to have to start pumping breast milk during transition and things like that. But I did do a sprint, and I actually ended up winning my age group. But everybody's like, "Oh, that's so great! You're so badass! That's so awesome!" And and I felt great. But in retrospect, knowing what I know now, was this a good idea? I don't think so. I mean, I got really lucky. What could have happened? A lot of things that I'll go into detail about a little bit more later. But I basically got away with it. And, I did this race at 11 weeks. And, that means I was training for it probably around 3 to 4 weeks postpartum. I was like planning it. And I know that I started walking at about 2 weeks postpartum, which is certainly something that I would not recommend. But, I didn't know any better. I was listening to my body. I felt good. I didn't have any symptoms. And like I said, I was lucky and I got away with it. But this is certainly not what I would recommend, most women or any woman. But I'm just telling you what I did because I didn't know any better. But when you know better, you do better. So this is now not the advice I give people, but I always put this in because I want you to know that guidelines are guidelines and that they're not set in stone. So I'm just going to move on from that. So after telling you that, I'm going to say that 6 weeks is not a magic number. Returning to running in sport should really be based on criteria and not time, right? So if you are a clinician and you treat patients after any orthopedic surgery or whatever injury, that some people progress slower than others. Some people are really quick. Some people bounce back. I hate that phrase, bounce back, but some people do return to function and sport relatively quickly compared to other people. And there's, lots of factors that go into why someone might get back to sport before. But it shouldn't be based on time. 6 weeks is not a magic number. It should be based on whether you meet these milestones or criteria, as I'll discuss later on.